know it's the week. There it is, being recorded. I know it's the time of spring break and everybody has multiple things they're juggling, and I really appreciate folks jumping on and joining this session. Michael's keynote was quite inspirational. He talked about this third leg of the stool, right, which is what platforms or applications can patients use on a day-to-day basis to help them when they're physically not in front of medical staff. And I think that's what this session is about. It's about connecting patients to others that will guide them and help them through their own specific journeys. I did want to just introduce myself and Mark Garza, who is co-moderating this. My name is Srini, and I'm the founder of a digital health platform focusing on cancer care based in San Francisco. Mark, over to you.
Thank you, Srini. My name is Mark Garza, and I'm the founder of Flatwater Foundation in Austin, Texas. We're a nonprofit that is providing 100% paid access to mental health support, to counseling and therapy for families touched by cancer. So with that, Srini will be in the driver's seat here, and we hope to just facilitate a great conversation on the topic.
Awesome. I've just got a couple of kind of slides here for us to help us navigate this. Let me know if everybody can see my screen. Yep, awesome. So I'll tell you, when Suzanne approached Mark and I to moderate this session, she said we need to think differently about brainstorming for ideas, and also approach this as if there were no limits to resources. The thing that kind of stuck in my mind was the whole think differently part, right? What I have here in the next slide is a 1-minute video that I think will help all of us start to think differently. This is an ad that Apple ran back in 1997 to really energize their company, the computer industry, and the electronics industry in large. So just indulge me in this, and I hope it'll get our creative kind of juices going here.
Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs in the square holes, the ones who see things differently. They're not fond of rules, and they have no respect for the status quo. You can quote them, disagree with them, glorify or vilify them. About the only thing you can't do is ignore them, because they change things. They push the human race forward. While some may see them as the crazy ones, we see genius. Because the people who are crazy enough to think they can change the world are the ones who do.
I have to say, every time I see that video, and I've probably seen it a dozen times, it gives me the goosebumps. It really helps us think about approaching various challenges differently. I would love for us to adopt this mindset of crazy ones that is talked about in the video, and really brainstorm for what a 21st century platform or an app for cancer patients could look like. And hopefully this video has set us up well. Mark, just any thoughts on the video itself, or just getting people sort of energized in this discussion?
Yeah, absolutely. I thank you for sharing that. It's something that that resonates with me a lot. I know that video. I've seen it probably 50 times. But the essentially in this discussion, I think we have to let go of that notion of this might be a bad idea, or maybe this isn't reachable, or just thinking back to sort of all of the discussions we've had, and then what we've created, Srini and myself. It was all based on stuff that didn't exist and seemed impossible. And for me now as an 11-year reality, I think what's really important to make any progress is to break down every single sort of constraint that we've set on ourselves and let all those go, especially for the next few minutes, so we can really make some true progress.
Yep, absolutely. No, great. Thanks, Mark. So a bit of housekeeping. We have about just under an hour, and I just want to be mindful of time and spend, enough time on each topic. So I'll try to attempt to keep us on track and move us along. And Mark is here to kind of keep me honest. And if I go off into the deep end, he's going to help me out. Again, echoing what Mark said, it's an even playing field, and none of us really have the answers. If we did, then, this would not be a huge problem as it is. And we really want to surface everybody's ideas and solutions on this. So I think just given that it's a relatively small group, I think it might be a good idea to kind of just do quick introductions. Maybe if you could just kind of introduce yourself, name, maybe the city where you're from, and what interests you, in this particular space of connecting patients to the right resources. So I see Art, you're alphabetically up there on my list. So maybe Art, if you can kick us off, that'd be great.
Sure. Art Taft. I'm in Greensboro, North Carolina. I am connected with MedWorks Consulting, and we do get involved in oncology discussions.
Thanks, Art. I'm trying to figure out where I can see the list of all the names, but maybe who can go next?
I can see the list of everybody. If you go, David.
Go ahead. Sure, my name's Dave Weisberg. Srini, if you unshare your screen, then we'll all be able to fit. My name's Dave Weisberg. I'm a design thinker, and I'm just about to start on a project that does connect people to other people like them, services, care, services, products, etc., that make sense to them in some sort of a networked format.
Thanks, David.
And I'm in Boston.
I think you were on the session last time, I remember, so it's nice to see some familiar faces. Mark, who's on next?
Cindy.
Hi, everybody. I'm Cindy Cohen. I'm the Global Program Director of Kids Kicking Cancer. Our offices are based in Michigan. That's where I am at the moment. We have programs across the globe, and my interest lies in, we are in app development, as well as digital outreach and digital platform creations to reach children and families dealing with cancer across the globe and connecting them.
Awesome. I believe it's two of you, but we have Roseanne.
You're muted.
Hello, can you hear us now? Can you hear us?
Yep.
Are we unmuted? Hi. We're speech pathologists and dietitians, and we have a company called Textured Food Innovations. Our goal and our mission as speech pathologists and dietitians is to improve nutrition for cancer patients, give them food that's healthy and nourishing instead of all the chemicals that they're involved in having. Give them pleasant food, good nutritious food, and our mission is that food is medicine, and that's what we're trying to do.
So crucial. I'm so glad to have that represented. Thank you. Patrick.
Yeah, hi, I'm Patrick Gage, and I'm a 12-year survivor of non-Hodgkin's lymphoma of the central nervous system. I've worked in the mental health field, psychiatric, for 36 and a half years, and after I retired, I became a grief support specialist. I'm an angel mentor. My mission is, I don't care what kind of cancer you have or your age or whatever you're from, I hope to bring hope, dignity, and peace to that journey. Because without hope and without dignity and without peace, it's a tough struggle. I mean, it's going to be tough, but in order to ride the waves of that journey, You have to find strength, perseverance, courage, and you may get it from all different kinds of sources because you're going to need all that.
Absolutely. Absolutely. Thank you, Patrick. We have, is it Ashik? We have you muted.
Hi, my name is Ashik Kaku. I'm with White Kids Cancer. We're based in Dallas. We're been around for 40 years. So this is what's interesting to me. I got the email from you all, and I thought the intersection of cancer patients, which is very interesting to me, and mental health, which is also I have an interest in as well. Honestly, I'm just sort of listening today and just trying to figure out where can I learn things from people who've been in this longer than I. So thanks for the opportunity.
Excellent. Thank you, Ashik. And Liz.
Hi, I'm Liz Curran, just outside of Philadelphia in South Jersey. I am a holistic cancer health coach with a team of 2 others, and we have created a community called the Health Navigators. And what started out as, health coaches looking to teach lifestyle change to cancer patients evolved into this huge opportunity for social support. And so our original business plan, while still in effect, has really become much more focused on virtual psychosocial support over the past year. It's been pretty incredible to watch the community grow and the connections that you can make so intimately and so deeply over Zoom. And I loved the talk earlier in the term digital nutrition, because it's so powerful. And that's really, I think, one of our aspirations, to use that word, is to really be, have a positive impact on people's digital nutrition as they go through their cancer experience. So that's kind of, very, very hit home for me this morning. So nice to meet you all.
Thank you. It is a very powerful thing. I'm sure we'll touch on quite a bit in the next 45 minutes. Chris, I believe you're up. We have Chris, then Danielle, and then a very special guest, William.
Yes, hi, my name is Chris Lovell. I also work with MedWorks Consulting. Have a specific interest in healthcare consumerism, and both Art and I have had a long, torrid and interesting history around chemotherapy and cancer treatment in managed markets. We're very interested in empowering patients who fight a lonely battle. And we feel that, creating social networks of people with similar experiences can only enhance their journey.
Excellent. Thank you. And Danielle?
Hi. So my name is Danielle. I'm in Pittsburgh. I am working with the face-to-face organization with Karen Shilley and Adrienne Dethrone. And basically they are cancer survivors. And we work with people who, and they found a need because they both had some challenges after their cancer and weren't able to reacclimate themselves into life and get the assistance that they needed. And so they found that there wasn't a space. And so they kind of created that with face-to-face. And so I am a graduate intern and I am working with them. And so I'm just here to just see, what the market looks like, what potential futures I might have as a potential social worker working in an oncology department, just working with this particular population and just trying to learn as much information as possible.
Fantastic. Thank you so much. And then we have William Schroeder, who's joining. I mentioned that I'm the founder of an organization here that's matching those in need with mental psychosocial support, actually paying for their therapy treatment. I've had an advisor for almost a decade now in the field who's been just a fantastic part of our growth and our approach, but he's joining us on the call as well. William?
Hi, everybody. Of course, this is when I get choked up here. I'm a mental health therapist here in Austin. We have a practice. I guess we have 39 people working with us now. And we do a lot of work with Flatwater. So we end up ultimately working a lot with client side of support of people that are going through cancer. I got involved with it originally because of my dad getting cancer. And I ended up reaching out to Mark, and I was so inspired by his mission that we started collaborating together. So anyway, it's been really neat to see the side of everything that he's doing, of building a model that's very qualitative and its focus of care on people, that also isn't as term limited as you will find with a lot of insurance models that are currently in the marketplace. And, you know, really creative and getting people involved that really want to make a difference. So, you know, from his volunteer base all the way through. And I know that this past year has obviously been very challenging because of that. But yeah, I'm happy to be involved and give whatever feedback I can.
Awesome. So with that, Srini, thank you, William. With that, let's get rocking.
Cover everybody. Awesome. So it's great to have representation from so many different perspectives, right? I mean, looking through here, I heard David as a design thinker. We've got folks who are speech pathologists. We've got survivors, caregivers, health coaches, social workers. I mean, if this group can't, you know, up-level cancer care, I don't know which group can. So it's really great to have everybody on here. I think, you know, what I'll do is just to kind of frame this discussion, I thought it'll be helpful to, I put together a couple of slides. And really the idea here is we want to challenge the status quo, right? You know, clearly there is a gap between, you know, what patients are looking for and maybe what's available out there. There is no sort of one-stop place. You know, if you're looking for, you know, consumer goods, you go to Amazon, right? If you're looking for a ride, you go to Uber. There isn't one platform where, for chronic diseases and more specifically for cancer, you know, at least we haven't come across one. And I know, David, you said that you were starting to kind of think about some ideas. So definitely would want to see if we can, you know, have you chime in here. I'll do my best just in terms of teeing people up, right? So that way you can kind of get your thoughts. So I'll call people out, you know, let you know that, hey, you know, we're looking for some input or feedback from you on different topics. But, you know, I wanted to just kind of break this out. I mean, the session is all about connecting to others like me. And I just wanted to up-level that topic a little bit and really say, connecting to others who can guide me, right? And people who can guide you could be survivors. They could be other patients who are currently going through treatment, or it could be people like, you know, health coaches or other professionals that can really sort of help you through your, you know, current experience and journey. So I wanted to maybe dissect each one of these a little bit and dive deeper into what a potential new platform can address that is maybe missing in the market right now. So connecting is one word I want to dive into. You know, others. What does others fully encompass, and what does guide actually mean? So with connecting, let's start there. I think the question is, who needs to be connected? What does that connection actually look like? And how would it function in a platform or an app? I'll set this up and I'll maybe turn it over to David because it sounds like he's maybe kind of thinking along these lines. But at least one of the things that, you know, we've come across is, you know, if you're a patient who goes to a large cancer center, typically there's a registry of patients that the hospital kind of, you know, has that you can tap into, which I think is great. It's better than not having anything. But I kind of think of this more like, you know, not to trivialize it, but more like a dating thing, right? If you're looking to get set up and your friend kind of sets you up with somebody, and it's kind of like a blind date, right? You're going to go along with it, but you're going to feel more empowered if you actually find that person yourself and you go out on a date. So kind of bringing that back to patients and cancer, at least, you know, our approach is that if you empower a patient to go and find similar people like themselves, they're going to be able to connect with those people and have some meaningful conversation around that. So I'll stop there and see if, you know, I'll start with David and maybe there's somebody else who can chime in as well. What does connection mean? And, you know, how do we make that work?
That's a big question. I think it's interesting. You know, people, as Michael mentioned, people want to be with other people, and I think we want to be with other people for all sorts of reasons. I think in some cases you do want to be with someone who's just like you. Maybe they're lost, you're lost, and just to commiserate, like exactly like you. So if they're right on your level, I'm the same. And then sometimes you want to be with someone who's a guide, and so forgive hierarchy, but like you want to connect with someone who's ahead of you. And because you don't want to just be lost, you want someone to give you some insight. Of course, you want to be empowered. You don't want to be driven. And sometimes you actually want to help somebody else. So maybe you want to find somebody else who's a little behind you in the journey, let's just say. And often by teaching, we learn. So I think each one of these, you know, there's room for different types of connecting in the same network. Like you could imagine a huge population of people who have been there before in this medical center, let's just say, with their group, you know, that's local. So you could actually go meet them. Although in this world, we do a lot on Zoom. So you could talk to people. If you have a rare cancer, you could talk to anyone in the world, or at least anyone who speaks your language, right? So we could think about, so you asked, like, in design, you try to sort of narrow in what you're looking at a time because there's too much. So you could think about, how do we find people like us? That's one statement. How do we find people who are ahead of us, or what are all the different guides, and how would we like to select them and find them and meet them? And then, of course, that's just the inverse of this problem here. I find it hard to point on Zoom. So if you're looking, like, let's talk about how would you like to sort through people in a world where you're looking for a guide, you know, and maybe start to think, like, if it wasn't a digital thing, if it was just you and your friends or a community, like, how would you do that? And then we map it into the digital space.
Yeah. No, I love it, and I love how you're so visual with everything. That's it's awesome. Maybe I'll turn it over to William, and then maybe we can go to Liz. William, I mean, just in terms of you know, all the health coaches that you know, you have as part of your organization, what are the common themes you're hearing in terms of connection, and what are people yearning for?
So one thing that came to mind is I feel like something like a vSafe for cancer patients would be helpful. And what I mean in that, it's not directly answering your question, but it's something that's polling people to be able to see how supported they feel. And using that as a means to figure out kind of what's missing. Because for one person, kind of like the previous person was saying, it's like, it's true, like mentors could be really helpful. Here we have like Breast Cancer Resource Center and a variety of different things that are like that have support groups that can be really helpful. For another person, that actually might be quite too triggering. It's like an over-identification with what's wrong, and it may be too much, and they may need something that's tiered down a little bit. And something like that could be really helpful. And when I say vSafe, I'm assuming that you know what that is, but that's the thing that the CDC put out for people to be able to follow up with them on vaccines to try and figure out kind of, all right, how are they feeling? If there's a problem, what area is that in? You know, basically trying to be able to monitor the effectiveness, efficacy, you know, all the different stuff that's going along with that. And it kind of has conditional logic within it to figure out, you know, what's going on. And something like that I could see also being very helpful for people to try and figure out whether it's like, all right, are they having a problem, and that maybe they're, you know, the oncologist that they're working with actually may not be the right fit, and they're not feeling supported by them. Or, you know, it may pertain to another area. So it's just trying to figure that out to then correctly target the resources towards it. I'll say from a mental health perspective, it's interesting seeing people through the journey, and everybody's journey is different. Because, you know, sometimes you're seeing somebody where it's really, you're looking at an end of life thing, an event. And so they're needing support, not only to process that for them, but also for their whole family unit. Do they have kids that are left behind, a husband that's left behind? And so we end up building kind of a circle of support around that. And that's been something, thankfully, due to Flatwater, that we've been able to do, is to be able to have a comprehensive thing, because it's not just that one person. And it is that whole system that's then left. And it's been neat to be able to see some people through like horrific loss, and to be able to see them come out the other side and have something that really does support them and fully through that. So that way, like, you know, there's children that I've seen come through it where they've truly processed, you know, what's happening to mom or dad. And, you know, as they've come through it, it's not scary. You know, it's not, you know, their nervous system is processing this in a way that's complete, as opposed to something that feels like a lot of whispered conversations and they're not sure what's wrong, but they know there's something wrong. And then it becomes kind of the scary thing for them in life and causes a lot of like difficulty as people age. Like if you look at the ACEs study, which is a really good study of, you know, 40 years of, you know, the results of trauma, this is one that we can remove for people by having, you know, these like events that happen that hopefully can be supported and pulled through. So as a mental health professional, I'll say that that's been, you know, a really valuable piece, is to have the mental health support wherever people need it, whether it's, you know, one person may be going through treatment and treatment's kind of enough on its own. And, you know, another may actually utilize that support during that time. So it's helpful to be able to customize that. And now with telehealth being so widely available, it really does remove a lot of barriers to that care, because certainly we've had a number of clients that we've worked with that have been facing a terminal diagnosis, and, you know, coming into the office is kind of a mixed thing. For some people, they're very scared of it, and telehealth removes that. And then for other people, like even during COVID, they've wanted to come in just because they know that like they have a terminal illness, and having that human connection means so much. So having that variability has really been important and key for us to be able to do, and for mental health providers. So anyway, that would be kind of my 2 cents. And, you know, I think it's also looking at the myriad of resources that can then be offered inside of that, of, you know, really trying to offer, you know, like meditation pieces, and like building kind of an educational umbrella that can also be in there based upon those needs that you could do from polling and seeing like, what are the gaps, what's missing. And I think that even something like that could be applied to technically the therapist too, to be like, you know, what are you seeing that are needs of your clients that are unmet? So you could apply that same model there, because they're going to probably have a little bit of a different perspective than their clients may have.
Right.
Yeah.
So part of the discussion that we said was, you know, we're going to try to disrupt the status quo, and you know, we're only going to be able to achieve that, if we're able to pressure test each other, right? So it's William and Mark, and I'll go to Liz very, very shortly. I'm curious, like in your work as, you know, in nonprofit, in Mark's case, the amount of resources you have to expend given the size of the problem, right? So when I think of a platform, I'm looking at, okay, how do we scale something so you're not having to, you know, throw one resource to match one patient, right? And I'm sure I see Mark kind of nodding. I'm curious, like what ideas or strategies you might have already kind of thought about in the past to help scale this, right? Because you only have, set of resources, set amount of money to help the 1.8 million patients every year.
Yeah, I would say what I'd like to put out to the group here is the notion that, and I really like what you were saying, David, those connections, but the notion of, while it's very easy to think in this communication and connection and ability to interact, and we're talking about Zoom and talking and whatnot, it's really becoming more important for people to be able to find a resource and seek out that in a less dynamic way, more static way of content and stuff that's out there and they can consume on their own time. Something that came from the last session that Suzanne mentioned that sort of inspired this next step is the notion of sort of a database or information or stories, consumable information and emotions, and a journey that can be taken on one's own time when they can, because time is just the resource that none of us have. So I think it's important that as we think about that asset, we think about how it can be created for some passive, for us to consume that digital, that, as the make our digital diet can be on our time, if you will, and also in a way that helps us still feel connected. In doing so, we can then scale and grow. It has to be a lot of automation as well to what we do, and anything that's created to scale. Automation has got to be the giant pillar underneath that.
Yeah, couldn't agree more. I will go to Liz now, given her, I guess, experience as a health coach. What is she, Liz, what are you hearing? Like, what does connection mean from the clients that you work with? What are they looking for?
Yeah, sure. There were two meanings that came to me as you guys were all speaking. And the first one, from the perspective of a health coach, for those not familiar, kind of a big difference between a social worker and a therapist and a health coach is, health coaches come from a place of accountability, goal setting, and trying to move from where you are today forward and not really hashing too much on the past stuff. And we, by all means, partner and encourage at all times to parallel their time with us with someone that does work in that more psychosocial umbrella from a social work perspective or a therapist. What I have found with my one-on-one clients is that we play a role of kind of almost like, I want to equate myself to an electronic medical record almost in human form. So they talk to us about their hospital doctors, and we work in more of an integrative way. So a lot of our people have maybe a naturopath, and then we also have their therapist, and we have their, exercise specialist, and all of those people may not know of each other. So connection to me would, and I haven't quite figured out how to harness this yet. So maybe one of you geniuses out there that I feel really empowered sitting next to today can help figure out how can we create an even playing field among practitioners so that the doctor in the oncology center doesn't have all the say, and allow these really knowledgeable, integrative, and more widely, a broader approach come together to talk, to help. I know this is kind of goes against the whole scaling feature, but as a health coach, a lot of my sessions will spend a good portion of it collecting all the data that they got from all over the place, and how do they create a goal for themselves out of it for that week. So one aspect of connecting is connecting all their practitioners, and how can we make that more efficient for them so that their practitioners can communicate with each other without them feeling like, one, they're cheating on each other, or maybe they're doing something with one they don't want to tell the other, and the other needs to be open. If they're going to do it, they need to be able to say they're going to do it for their own safety, honestly. So that's a really crucial part of, alternative meets conventional, and somewhere in the middle. And where can we live in that middle and grow that? Because quite frankly, there's a lot of people that do a lot of things outside of their hospital system that they may never know, and it's not always safe. So how can we make that less of a stigma and more approachable? So that's one aspect. And the other aspect of connection for me is that where we go more with our group coaching is providing space almost in a group therapy setting, but we're not therapists, so we don't take that role. So when we found we were doing group coaching, and there were a lot of patients that were coming, some were in the hospital, some were already past chemo. So a whole spectrum, no specific type of cancer, no specific stage, but they were all coming together. And then we found not all of them wanted to do really coaching. They didn't really want to goal set and be accountable the next week to it. They just really were showing up to see each other. So being that we weren't therapists and we weren't going to facilitate a support group, we tried to figure out a way to provide that from a health coach's perspective. We started a book club, and we started with one of the platforms we work through is this program, Radical Remission. And there's 10 healing factors that are essentially lifestyle changes. So we would read one chapter a week on that topic, and all those people, no matter what your diagnosis or stage, would come together and talk about that topic. And then to go to David's perspective, some people were able to mentor, some people were able to be taught, some people found their, someone lived in the same city with the same diagnosis, or, so it allows that all those different roles to be played out week to week to week based on the topic. So, and from our perspective, it's all lifestyle change because that's the health coaching twist, but that has been by far above and beyond the biggest gain I have seen over the past 12 months was that connection. And that was my biggest aha surprise out of this year was the power and the healing that came from it tremendously every week. The gratitude that these people have for each other and for us for providing the space is just, it's unbelievable. So that would be my other aspect. So connecting practitioners and then connecting peers.
Awesome. No, thank you, Liz. So I'll go to Roseanne, and then maybe I'll go to Art afterwards. But on the topic of integrating, really having a team around the patient that talks to each other and is integrated. Roseanne, being, I think you said you were a dietitian, focusing on nutrition. I'm curious from your experience on the physician side. I mean, I've heard, some patients come back from a physician who says, the oncologist told me not to change anything, just keep doing whatever I'm doing, right? So I guess my question to you is, how do we connect patients and caregivers to the right, how do we connect patients and caregivers to the Roseannes of the world who know how nutrition can play a positive impact? And then I'll go to Art, who I know is working on, working with the CDC in essentially kind of defining cancer as more a chronic disease, where some of these things will hopefully just come into play. So Roseanne, over to you first.
Okay, so as speech pathologists, we're working very closely with the patients, with the physicians, and determining the correct level, textured level of food for the patients, depending on their diagnosis or at what stage they are at. So we would be working in collaboration with the other professionals on the team, as well as with the patients themselves, and setting up support groups for the families and for the patients to guide them through their journey.
Yep. Great. Art, over to you to kind of just
sure. I'll get to what you introduced in a minute, but I actually want to talk a little bit about what we're hearing. I mean, part of the issue of connecting isn't because there's a lack of information on any of these conditions. As a prostate cancer survivor, number one, there are plenty of books that talk about key issues like treatments and consequences. You can obviously talk to the clinicians you're working with. Quite honestly, a lot of times they're not the right people to talk to because they're interested in the science and they're busy and moving on. But some of the stuff that we've been doing with a group that's called the Association for Value-Based Cancer Care, which is an attempt to bring all of the players in cancer care together. And our role has been to bring employers to the table to talk about the way they interact. But you realize very quickly when you think about coaching, the pharma companies will have coaches available to patients that are likely to be on their meds. And their objective is to try to get those people funded and get the products purchased, but to make it valuable, they add other services. If you think about the clinics themselves, they're offering social workers and other kinds of nurse practitioners, coaches. So there's a duplication in that source. Then you move on and you do get all the not-for-profits that are offering support as well. So part of connection is sorting through who's the right people to talk with. And how do you engage them and how do you validate them? So there's a curation factor. I mean, the CDC is definitely, engaged right now in looking at cancer as a chronic disease. Some of these treatments are multiple years. It's not a surprise. And they're looking at the idea that peer-to-peer kinds of interactions seem to get better results, better outcomes. I'm not sure whether you can claim it's been fully documented or not. And it's clear if there's a way to look at the data. I mean, it's not necessarily looking at a single patient's experience. It's looking at 100 patients or 1,000 patients' experience as you organize the data and then identify what paths seem to have the best outcome and use that as a way to offer it to new patients using, David's model where, you're talking about pathfinders, if I can describe it that way, and turning around and giving other people information that helps them later, depending on the stages. that's not necessarily a person. That may be 100 or 1,000 people that not only provide the individual some ability to sort through the different outcomes, but it also provides the coaches feedback. And it helps people like Roseanne, as you're looking at diet and nutrition, that if you look and have some information about what people were doing with diet and nutrition in one area, and suddenly you see a pattern, that helps refine and does the continuous learning environment. But to me, I think it's a connection with people that have experience, as David laid out. It's connections between the coaches so that you're able to find the right coach for you, as well as curators, to make sure the information you're sorting through can be validated. It's finding the right specialists at the right time in a way that makes sense, but it's collecting all that experience to make the decision process in the future better, is I think what we're trying to do.
Awesome. Does anybody have any kind of thoughts on what we've shared so far? I did want to go to Danielle, who is, if I remember correctly, is a social worker, and I see patients and caregivers maybe opening up to their social worker much more than let's say they would to their oncologist, right? So anything that we've shared so far that anybody wants to kind of comment on before we go to Danielle?
I just want to say thank you, William, for your contributions. I know you have a noon, and we appreciate your time. Thank you, sir.
Yeah,
Thanks,
no worries. Thanks, Mark. Thank y'all.
Cool. Danielle, floor is yours.
Yeah, so in regard to patient care and caregivers, I don't know if you guys can actually see me. Can you hear me and see me?
Yep.
Okay, so in regard to patient care and caregivers, I think that everything you guys said was spot on in terms of creating a space where you are building comfort with the client. And I think that if you can build that relationship, I know originally when I first kind of popped in, I kind of had some technical issues. So I heard like a breakout, but I heard the idea of creating an app. I think that will be really interesting and innovative in terms of giving clients, because I feel like I've never been a cancer patient, but I feel like if for clients who are trying to navigate this system that may have limited or lack support in some capacity, I think that having something at hand that they can kind of navigate to kind of figure out what is going to be the best course of action for them in terms of getting the best care and what that looks like. And do you need a life coach? And do you need a speech pathologist? Of course, those things are going to be recommended by your primary care, but, considering what that looks like in regard to that relationship. So I think that if we can create a space where the client feels or the patient feels comfortable with what they're understanding and with the knowledge that they're receiving, I think that that'll be helpful.
Cool, awesome. So I think we've dived pretty well in on the connecting piece. I'd like to kind of move to the next topic, which is around others, right? What does others, who does others include, right? Should it, for a patient who's potentially using a platform that we're looking to design, should it be just their type of cancer? Should it just be their stage of disease? Now, obviously, there are, intricacies to do with like breast cancer versus colorectal cancer and so on. But, the question I pose to this group here is, what are the categories where it really doesn't matter what type of cancer, right? Because there are certain things that we know are applicable to everybody, right? So maybe it's nutrition, or maybe it's having access to a great health coach like Liz, or maybe it's having a great app that David creates, right? So what does others mean to people on this forum? So maybe I'll go to Liz first, and then we can go to David after that.
Yeah, so one thing that just came to mind when you were talking about the term others, and just from working with people that are kind of all over the spectrum, I almost feel like we can leave the people with the exact same diagnosis to the hospital systems, let them provide the mentor. But when we're talking about like that social support angle, or the level of stress, or struggling with changing your diet, or what is your exercise, like they're all just human problems, and they're exasperated by a diagnosis. So I don't think that having it be super specific to somebody who might be ER/PR positive with breast cancer. Yes, there's absolutely a place where people want to know and have a mentor who's been on the other side and hear that survivor story. However, I think in the greater scheme, just looking across the lifestyle change struggles that people have with stress reduction and can they meditate? They're struggling with meditation. This one is great at it. Where are they on the spectrum? All these little pieces that really have proven to boost your immune system and provide a higher quality of lifestyle while in treatment or after treatment, maybe even preventatively. So others, I think, looking at it more broadly is also a little bit easier if you want to look at it that way, because you can group people in a broader way and they will get experience from a bigger spectrum. The other aspect to others, when I look at this sentence, connecting to others to guide me, that others piece could be, somebody mentioned earlier, having a really refined, vetted database of practitioners or modalities, that is the biggest question mark. Who is going to be the one that provides that in a vetted, reliable way and still be able to market it out there for everybody to understand and know the access? I think, to me, that's a yet to be seen. Hospitals have great resource pages, but it's for their own agenda. So how can we have almost, I don't know if you guys have ever heard of the Environmental Working Group. They create the Dirty Dozen top, they do a lot of third-party vetting of things, whether it's, food, or it's kind of like the Consumer Reports of natural products, but something like that to create a third-party vetted list of resources, I think is necessary to have it come from a trustworthy source, but then also for it to constantly be updated it's just exhausting. So I haven't found where that others database can really be hosted yet. I know I try to keep up to date in areas for my clients that seem to come up, and always offer them, 3 or 4 practitioners that I know others have used or I've spoken to personally. I know but I'm just one person working with a subset of people. So how can we make that much broader and more robust and have better access? So those are my 2 parts to others.
No, I love it, Liz. And I think, something that you touched on, which is, sorry, I just lost my train of thought. There's so much great information being shared here. You know what? Actually, I'll go to Chris, who I think may have some interesting ideas based on his consulting work. In terms of what the benefit managers and organizations that employ hundreds of people. What are they looking for in terms of connecting their employees with with folks that can help them?
That's an interesting question, Srini. It really, sometimes they're very schizophrenic because on one side, they see the numbers. They see the costs of oncology treatment going up and up. And there is a general concern. But at the same time, right, most benefit managers want a quiet life. And the biggest nightmare they ever see is, maybe to get a phone call, right, for saying, why is Johnny not getting access to his treatment? So, it's kind of a twin-edged sword. I think an area where there are self-help and community organized programs would be very attractive to them. It fits into their overall health and wellness concept. And, both Art and I have looked at this COVID environment as a very interesting area because it is moving telehealth and people getting used to utilizing teleconference systems much more easy, probably faster than it would have done in normal times. So I think adoptions of adjudicated networks where cancer people, cancer survivors, cancer patients can find people with similar conditions to their own and be able to share experiences is going to be very powerful, because my wife had stage 4 breast cancer, and I would say she was probably one of the most pleasant people I've ever met in my life. Dubious choice of husband sometimes, but one of the things she said was, I don't want to hear about people with stage 2. I don't care. I want to hear about people with my condition. And that thought has stuck in my head for a long time. And I think if you can create larger community networks, it opens up the opportunity to almost like have customized experience sharing. Whether that's a good thing or a bad thing, it all depends how it's designed and how it's adjudicated. But my personal feeling is that the adoption of technology is rapidly increasing in healthcare because of COVID. And once the genie's out of the bottle, it's not going to go back in.
I love it. I maybe want to take that thought and go to David. Patients routinely go to Facebook and Google for everything now. Doctors typically, physicians will tell patients not to do that, but they still gravitate towards that. So David, like in your estimation, what is good about these current platforms that everybody goes to, the Facebooks and the Googles of the world? And what is the gap there, right? Like, what is it that potentially this group of innovative thinkers can build that Facebook or Google cannot?
So those groups are the leaders in creating affinity, based on the nuances of the language you use and choices you make. And so, and we've all seen how those can lead to great failures. They can create, echo chambers. They can create great understanding of all the wrong information. But they're the best at it in the world. So are we going to be better? Are we going to have a little startup that's better at search than Google? I don't think so. I think, but you could create good enough search. You could certainly create good enough search for data and for papers to be read that have been curated. But let's talk about connections between people and people under the big banner of mental health, right? So it's all about, like, what we want to focus on is not just connecting people for information, but connecting people for mental health when they're dealing with cancer. And so that's less about the data behind some treatment, more about, like, how do I cope? How do I figure stuff out that's complicated? And back to how do I cope? I think that algorithms can do a certain amount, but as Liz pointed out, there's this social sorting that you can't, if you don't program in the right algorithm, you won't get joined with the right people. So, like, there's all this bias built into these algorithms. So people will find the people that they have affinity with if you expose them to those groups. So I think, so there's that dimension, algorithm on one end, which is what Facebook and Google does, and then the other end, which is what we generally do in our community. At your church, at your whatever, you're like, you meet people and you hear, oh, you should talk to this other person because I know you'd like them. And then there's this other dimension that Liz pointed out. Let's not just, like, match people up based on their cancer, but based on their need. Like, they're stumbling over nutrition. Doesn't matter if they have prostate cancer or breast cancer. Like, nutrition is a hard thing to get your mind around. And so in human-centered design, we focus on needs. You got to figure out, like, what is it really that's their problem? Their problem isn't breast cancer. Their problem is finding a wig that goes with their kind of hair that's not common. Like, that's a need. So I think if we think about you've got needs and then affinity. Like, why don't I just want to talk to people who love cats? Like, that's most important to me. If I'm talking to people who love cats, then I trust these people, and I'll sort that first rather than breast cancer. And then I'll sort that they live in my area, and then I'll sort that they are about my age. And then I'm gonna be interested in what kind of cancer they have. But like, I don't even want to talk to them if they don't have at least 3 cats. So you could think about connecting based on what they love versus what they need. But needs are good too, but certainly like disease state, that's the default, and that's pretty boring, and that's pretty cold, and that starts with what I don't want to be associated with, and it's just not clear enough. So, and then on the other hand, there's algorithm versus letting people sort themselves out. And so I think you can use an algorithm to get a group together, and then you're going to really find the strong group, the strong links, by letting people find their own and having empowerment. So we call this a 2x2. So you just take 2 dimensions, and you could ask yourself, like, what does the solution look like that's totally about affinity and is just all getting people in the mix? It's really inefficient, but you're letting people use their judgment, versus maybe a system down here that's all about needs, like you answer a questionnaire, and then it matches you up based on the things you have trouble with. So you could start to look at solutions that live in these spaces, way out in the corners, because then that clarifies like what this space really looks like. And then, you might migrate back to the middle to get something that's a better compromise. You might still want to stay up here. You also might have a combination of solutions, right? There isn't one answer that helps a person with their mental health. There's their therapist. There's the people who are just like them, who they can complain together. And then there's the leader, the guide. So Liz had me thinking about that. And so created those 2 dimensions for me. I don't know if that's useful.
I love the visual again. It's just so awesome. I did want to go from what you just said, David, like the 2x2. I think you call it human-centered design, to another concept that's maybe a little bit more abstract, which is this whole self-advocacy aspect, right? So in all the patients, caregivers, survivors that we've talked to, what we've come across is self-advocacy yields to better outcomes, right? So so put another way, and I think research shows this as well, an engaged patient or caregiver yields to better outcomes. So the question then I kind of posed to this group is, what can we build into that platform? I love the need versus the love thing that you had in there, but how do we design a platform that that encourages people to become self-advocates, right? So that they're drawn into their condition. I mean, they already are physically and emotionally, but how do we get them like between their ears to get drawn in and become self-advocates towards their healing? So I'm not going to call. Oh, I see Liz. Thank you, Liz. I was going to call on somebody, but thank you. Go ahead.
I just have a quick thought on that. I think that is very difficult to do from a technology perspective. I think that falls more on the spectrum of, non-algorithm, but do it yourself kind of thing. I do a lot of that work one-on-one. It takes a long time to sink in with people. However, I think from a technological perspective, a way to fast track that is through stories. Lots and lots of stories that they can see other people's experience fighting that, or swimming upstream, I like to say. And so reading experiences that maybe they would get over time with a group or whatever, but if they can just dive into this database and dig up and read someone with their diagnosis or someone with their similar struggle and what they did or how they talked to their doctor. And then also that kind of maybe mentoring piece.
Anybody else? I don't know. Art, do you want to kind of take a stab at the topic?
Yeah, again, I agree with a lot of what's been said, that this is a multidimensional issue. If the comment about cats is absolutely right. If somebody feels comfortable and that creates a relationship that gets them started. I also do think it starts with the problem, that if you're talking about getting self-advocate, when people are faced with one of the challenges, and it could be behavioral health, it could be something else. I think that leads to the stories, Liz, you were talking about. That, I'm looking, what do I do? And you find the stories. So it's kind of organizing it in a way that people can find it at the right time. Because if you give them too much information, which is the problem right now, I believe a part of the problem, then they don't self-advocate because they get confused, especially if the information is conflicted.
Yeah, absolutely. And Danielle, if you can still hear us, I know it seemed like you were in the car, but I'm curious how, what tools and techniques you use to, essentially get your patients and caregivers to really kind of get behind the driver's seat.
Hello, can you hear
Yep.
me?
Yep.
Okay. Yeah, I am. So I feel like my experience is just, like I said, building the connection. I think it's that creating that trust. I feel like if your patient or client feels that you're engaged and feels like you're knowledgeable, and if you're offering them the support that they need, I think that can kind of build that connection. I also agree with Liz in that the database idea is really great. And I'm working with a woman now, and she's just like, she has leukemia, and she's like in her 20s, and nobody looks like her. And so we've offered her support groups, but it doesn't help her because most of the people who have her type of cancer are elderly. That's the norm. It's just like an anomaly. And so, I think kind of having something set up for an individual like her who is trying to reacclimate themselves into life. And something that I've noticed as well is that people have their life kind of cancer or just illness, and it's like, oh, what does that look like? And so I think that just creating a space and being open to hear and to almost like be a sponge. There's a fine line of being a sponge and being a rubber band in social work, but being a sponge so that you can receive and be a space where that person can release those emotions, those insecurities, those feelings. I think that and with accompanying with what Liz said, including that, offering that within a database would be really helpful for the clients and build that connection between caregiver and the social worker or whatever department.
Thank you, Danielle. Mark, I will kind of maybe get you involved. And we've talked about a whole bunch of things here. All great ideas that can kind of feed into a 21st century platform, as I continue to call it. But what are the things we haven't talked about that you've lived and breathed over the last 11 years running the foundation and the various therapists that you work with?
I mean, we've covered quite a bit of it, and we've been able to kind of stay downstream in a very constant path over the last 9-10 years. But I think what we really need to see or remember with a lot of this is first, it was David illustrated it literally very well. I think we fall into a lot of traps of thinking that sort of like when I say automation is the key, I don't think automation is the key with algorithms and matching and sort of the dehumanization of what the process looks like. I think what we have to do is be sure that we can automate the implementation of the humanization of it. And what I mean by that is a great example for our platform that we've built over 10 years is there's a lot of getting to know somebody and the data and their story, and again, allowing it to live somewhere sort of passively, whether it's an onboarding process where an administrator can bring a therapist or a life coach or a cancer coach or somebody into the picture. I'll start with just that. The ability for a system to not bog down an individual or resource with vetting, reading through, going through everything all at once to kind of get to the point, which is, I'm raising my hand, I'd like to be a part of this, and then we all need to know about you. That can be very tedious, like the inputs. And so when I say automation of a system, I mean creating anything that's can be replicated and that has to happen a lot of times, being sure to provide a space by which those can be handled without a lot of interaction, with a lot of resource, like a therapist filling out what they do, their bio, their story, who they like to work with, getting to know them, and then replicating that over and over so we can get 500 people into our system, rather than getting on a phone call or a Zoom, hearing about their practice and seeing it, being able to create them as an entity, but then also putting all of that data into a system that allows somebody to get to know each of them on their own time, passively, see what they might think. A lot of where this world has gone in the past 10 years is mental health is important. We're going to put millions and millions, tens of millions of dollars into funding platforms and programs that will just pay for really smart algorithms. What Facebook and Google do really well is automation based on big data. We can't look at sort of that same big data model to save our lives here, because every single piece of data is a unique piece of data. If we can remember that all these stories, all these people, everybody going through it is similar, they find likes and likes and similarities, but we have to allow them to play it by heart. And I think David was saying it best when you go to the cats, right? And start there. What can we do to take off of the table and make it very easy to make all those pieces fantastic and easy and replicable, but then put the heart at the top? We can be very successful. I think we learned that the hard way by trying to just do processes and put processes in place and match. Secondarily, and then I'll leave it at this, because I tend to get really excited about this stuff and I'll talk for an hour, but we have to look at what we do create and build, and where it goes by heart, but also remember the big failure that we learn from, and failure is great when building processes, but the big failure we learn from is the flexibility of the fluidity, the dynamic structure of which, like, nope, here, because when we create something that's new, it's never been done, and by definition, nobody knows how to use it. So because nobody knows how to use it, knows how to go through it, they're going to be hitting walls and trying to get out of it and get back in. Just like Zoom in the early 2020, when everybody's like, what is this? We've got to be able to, they just crushed Google Meet, which Google had been doing in a very easy way for so long, but it's who can get you in and out and allow you to be really fluid, right? So we can't think that we're going to put a process or a platform or something in place and that it's going to be because we were so smart and we put so much thought into it that people are going to use it the way that they like. So I think everything, all the back end systems and stuff has to be built in a way to assume people are going to want to backtrack, come in another door, and be able to get out of there and go in another door and figure it out. And I think those are because what you thought you loved may not have, the cats might not have been the most important thing. It was baseball, or it was mountains and snow, and it was, and so I think people are going to be discovering themselves. But when you're forced to go in and say, where do you want to start? People pick based on what they think is right, but then they start to learn.
Yeah, and I think what you just said, Mark, I think the process has to be part of the journey.
Yeah, right, exactly.
I mean, right now, I think a lot of what's happened with health information is it's forcing people to put data into the system without giving very much out. And I think that crashes.
Yep.
But if you set it up in a way that, if you think about it from a normal process, you're feeling poorly, what can it be? You move from the feeling poorly to I've been diagnosed. What are the treatment choices? What are those things? And along those journeys, you start to, first of all, you're learning, it's your exploration. And effectively, you can you can provide that kind of process that is based on giving something back every step of the way.
Right.
Yep.
So, and I think that's the next step, is to get out of the data entry mode and get into how do people want to find the information? How do you let them find it in an easy and efficient way? And then how do you learn using that to help them match better, find the right people they want to interact with?
Exactly, and I think that to keep going back to the Google and Facebooks of the world, I forget which film it was. Maybe I forget. There's so much consumption of just like documentaries and data, but essentially the concept of if we are living in a world where these big companies have created something where if it is not for pay, there's always a product, and if it's free, you are the product.
Right.
We have to flip that on its head, because that's just the way it works. It's the way these are.
I think it's the social dilemma. It
is the social dilemma.
Yep.
It is. It's the social dilemma. So this is the whole notion of the social dilemma being such that, you know, it's free and you are the product. I think that's what we have the opportunity to do, is flip that on its head, because it doesn't make sense to do that as an investment necessarily in their world, but in this niche environment, I think that's the opportunity. And that's why it's all data entry, because that's all it's about.
Yeah.
So I know we're at time, and I don't know if the session is going to automatically end. You know, I think in a future session, I'd love to continue on these topics, including, you know, I think whatever we've talked about, you know, it might become like, let's say, like the Yelp or the Airbnb model, right? 5 stars, right? If everything we build is great, right, we'll get 5 stars. But what I'd like to dive into in a future session, maybe with the same folks, is, you know, what would get us that 6th star, right? And what would get us that 7th star? Like 7th star would be the user of our platform calling in, right? Saying, you know, whatever you've built is fantastic, right? Not just leaving a review, but actually calling in because they're just so impressed, and whatever we've built has really helped them and moved the needle for them that much. Anyway, I know we're out of time. I'm a huge advocate, folks, of cross-functional and orthogonal thinking. And in this forum, I mean, we had representation from, like, you know, every part of the cancer journey. I think maybe the one we were missing was an oncologist, right? But, you know, next time around, we'll get those folks in as well. But thank you so much for sharing your great ideas and perspectives. It's just been super nice. And I know this conversation will help us make a change. Any other parting thoughts from anybody?
I was just going to say thanks to everyone for their time.
Yeah, well, just to comment on that Yelp review, you've got to be critical as well. Can't give everybody 5 stars every time. So thanks for a great conversation.
Thank you. Take care.
Thank you. I think that 6th star is the proof of the ability to save lives.
Yep.
It's better outcome. I mean, there's a phrase that says quality is free, and it's normally used in manufacturing, because if you do it right the first time, you're not spending all that money to do it later. So the question is, if you can engage the patient in a way that improves the quality of the outcome, there are savings that can fund the process, not necessarily from the patient themselves, but indirectly for the people that are paying for their care anyway, in most cases. And so that's what I think the application is. Quality has to be there in terms of the outcome.
You just have to define what quality is.
Yeah.
That's the question. How do you define quality in this sort of environment? Is it customer satisfaction? Is it improved adherence to guidelines? A lot of different questions about how you would actually measure it.
Uptime.
Absolutely.
Yeah.
Thank you again, everybody, and we'll chat offline.